Hello, ladies and gentlemen. I am Dr. Lenon DSouza, and I am the Unit Chief of Endovascular and Interventional Radiology at Father Muller Hospital, Mangalore. And I also run the Vascular, Varicose Vein, and Interventional Radiology Clinic in Mangalore City. Today, I am here to talk to you about a very, very common problem. You may see it on yourself, you may see it on a relative, you may see it on a friend, and this problem is varicose veins. So varicose veins often can be seen as a bluish or greenish color vein, or often even felt on top of your legs, and occasionally you may not see them very well, but you may see darkened skin near your ankles, and all of this may be as a result of varicose veins. So like I mentioned to you before, this is a very, very common problem, and it's seen in both men and women. So the major risk factor for the development of varicose veins is a job that may require you to stand for prolonged periods or sit for prolonged periods. I often have multiple patients of mine who are bus conductors, who are teachers, who are tailors, and this may be amongst other professionals like IT professionals as well. And occasionally they can also be the presence of family history. That is, for example, it can be present in siblings, in parents or grandparents. So in varicose veins, what exactly happens is that these veins generally have valves, and the valves of these larger veins tend to degenerate over time. And when these valves degenerate, what happens is the blood gets accumulated in the legs. So now this can be made worse by conditions that require you to stand or sit for prolonged periods, like I mentioned before, but can often be made worse by being overweight, by having multiple pregnancies as well. Now, when this blood accumulates in the leg for a prolonged period, this can cause the skin of the leg to get darkened, it can cause it to get pigmented, it can cause your legs to swell, and often this may progress to wounds or ulcers over the legs. There are many conservative methods that will help to alleviate the symptoms of varicose veins, but they may not correct the underlying problem. So you may be prescribed to wear compression stockings, to elevate your legs, and even exercises can be excellent. So calf muscle exercises often help to squeeze out the blood from your legs and back to your heart, and this may help to empty these veins and alleviate some of the symptoms. Many of these practices help to lessen the severity of varicose veins, but often to correct the underlying problem, we must deal with the primary problem of the vein not working correctly. So previously, surgical methods like tying or stripping the veins were performed, but unfortunately, these used to result in large number of recurrences. Now, treatments from there on progressed to ablative treatments, that is, these heat-based treatments like laser, radiofrequency ablation of the veins, and also sclerotherapy, where we inject a medicine into the veins. And now these are established modes of treatment with relatively very, very good results. The problem of some of these methods of treatment, of course, is the requirement that you must wear stockings for at least 6 months or more when you undergo these thermal ablative techniques. But now, for the first time in India, we have a modern adhesive therapy, and what I mean by adhesive therapy is that we use a medical glue to treat. So this medical glue is made up of a molecule that we call NBCA, or N-butyl cyanoacrylate, and this has been approved by the FDA for treatment. So glue therapy is extremely promising and offers several advantages from traditional surgical methods as well as thermal ablative therapies such as laser or RFA. For one, glue causes the vein to instantaneously seal. The patient may only have a small 2 to 3 millimeter incision, and this is barely visible, maybe just below the knee or at the level of the ankle, and the patient is often able to immediately walk out of the OT or cath lab. There is generally no requirement for post-procedural stockings, and as of now, the results are said to be about 98 to 99% successful. The best part about all of this is that you can return to work immediately after the therapy. So we had a gentleman not too long ago who had uncontrollable itching and eczema over the leg. Now this gentleman is a very, very good advertisement for this procedure because he was the first patient in Dakshin Kannada to undergo this procedure. And let me tell you, he had previously undergone surgical and laser for his leg pains as well. He underwent this medical adhesive glue therapy, and his symptoms disappeared the very, very next day, and he was able to be discharged immediately. Now, since I offer this therapy to this patient, I have now extended this therapy to several other patients in Mangalore with very, very good results thus far. I understand that conventional therapies can be painful, they require long recovery periods, and often there's always a notion that when varicose veins are treated, that there's often requirement for multiple treatments or there can be large number of recurrences. But let me tell you, with modern therapies such as glue therapy, the results are fabulous. I highly recommend that patients must ask their physicians, their surgeons, about modern adhesive glue therapy for the treatment of varicose veins.